Thank you, Governor. Good afternoon. As has been stated, we have 54 new cases in Rhode Island. And as the governor also said, sadly, we have 2 additional fatalities. Our prayers are with those 2 families. One of the people who passed away was a nursing home resident, and one person was not. The nursing home resident lived at Golden Crest Nursing Center in North Providence. As we have been reporting for several days, nursing homes remain the most challenging settings right now. There are roughly 65 cases at Golden Crest among residents and staff. At Oak Hill Center for Rehabilitation and Nursing in Pawtucket, there are roughly 60 cases between staff and residents. There have been 5 fatalities, unfortunately, associated with Golden Crest, and 2 fatalities associated with Oak Hill. There are 12 nursing homes with at least 1 case among residents. Beyond Golden Crest and Oak Hill, Oakland Grove Health Center in Woonsocket has 6 cases. The other nursing homes all have fewer than 5 cases. The Rhode Island Department of Health and these nursing homes are taking dozens of aggressive measures working together. Residents with suspected or confirmed COVID-19 are being moved to private rooms, and nursing homes with cases are being instructed to limit the number of people who enter the resident's room to 1 staff person who can conduct the activities usually done by many other people. For example, homes are choosing 1 staff person who can bring in the food, assist with daily functions, and clean high-touch surfaces. This is an aggressive approach that we are taking after consultation with national experts and those in Rhode Island. The number of persons entering a room of a nursing home resident has a direct relation to the risk of spread of transmission. That is very similar to the stay-at-home order that the governor referenced earlier. Additional measures that we are taking are to treat the former roommates of confirmed cases similarly as if they have COVID-19 as well. These individuals, either confirmed cases or former roommates of confirmed cases, cannot be and are not being transferred to other units in the facility or to other facilities. That's what we refer to as cohorting, in helping to ensure that the cases are limited to a particular area or a particular wing to decrease the risk of transmission in a nursing home setting. Additionally, staff are aggressively doing temperature monitoring regularly of themselves while at work, including temperature checks every 4 hours. And active monitoring is also being done on all residents for symptoms. And of course, as is the case with all nursing homes now, all staff are wearing face masks or surgical masks, and no visitors are allowed into the nursing home facilities. These are just a range of the measures being taken. There are many, many more that are occurring. I wanted to provide a brief overview. I also want to take a moment to recognize the work, commitment, and hardship of the staff at these facilities, the managers, and the owners. Whenever we have unfortunate fatalities to announce, we also share our sincere condolences with the families of those who have passed. But these are also tremendously trying times for everyone who is a part of these nursing home communities. It's important for us to recognize them and their dedication too. With that, I want to also recognize the Rhode Island Healthcare Association. The association is doing its best to support member nursing homes and is working very closely with us to explore different options to respond to this current crisis. Separately, I want to reiterate a message that was shared yesterday. With Rhode Island's COVID-19 testing capacity now widely expanded, all Rhode Islanders who have symptoms of COVID-19 are urged to call a healthcare provider to get scheduled for a specimen collection so that they can be tested. It's important to note that symptoms of COVID-19 range very significantly. They can include fever, chills, cough, shortness of breath, muscle aches, which is referred to as myalgias, runny nose or stuffy nose, sore throat, headache, vomiting, or diarrhea. People with COVID-19 have experienced a range of different symptoms. We're continuing to learn from those throughout the country and are being deliberate about applying those lessons learned here. As we learn more about the virus, we know that some people with COVID-19 have only experienced 1 or 2 mild symptoms. Sometimes these symptoms just occur in isolation. Sometimes they are without a fever. It's important for us to continue to raise awareness for providers and the public that if you have any symptoms that are concerning for COVID-19, we have now expanded testing for all to be able to call your healthcare provider so that you can be assessed for testing. We have to emphasize the key is to call first. There should not be any healthcare facility that you just show up to, whether you're a healthcare provider, an urgent care center, or an emergency department. The expanded approach of testing all people with symptoms represents the significant change that the governor has been discussing as a critical component for us to pinpoint aggressive responses to controlling this virus. We know that COVID-19 testing in Rhode Island had previously been limited to the members of certain priority populations, those who are hospitalized, those from congregate settings such as nursing homes, and healthcare workers. We will continue to test those populations and want to make sure everyone is aware of the symptoms that you should call your provider for to be assessed. I also want to share one additional announcement. Going forward, we are now encouraging that Rhode Islanders can start wearing face coverings in public. Face coverings are different from regular medical masks, whether they are N95 face masks or other types of surgical face masks. At this time, people in the general public should not be purchasing or hoarding medical-grade masks, such as the surgical face masks or N95s, which are in short supply but are being addressed every day. Instead, we are encouraging that people can wear cloth face coverings. A cloth face covering is a material that can cover the nose and mouth. It can be secured to the head with ties or straps, or simply wrapped around the lower face. It can be made of a variety of cloth materials. A cloth face covering could be sewn by hand or can be improvised from household items such as scarves or t-shirts. So let's talk for a minute about why we are recommending this. The primary role of a cloth face covering is to reduce the release of infectious particles into the air when someone speaks, coughs, or sneezes. That may include people who have COVID-19 or some other viral illness, but may not yet feel those symptoms and may otherwise feel well enough to go out. We know the message is and will continue to be that if you are sick with symptoms, you need to stay home. Just because you have a cloth face covering does not mean it is acceptable for you to go out with symptoms. We want to do our part to limit the spread of respiratory droplets when people are in the community and in public. And we recognize that there may be times people are not aware that they have some of those mild symptoms. And so being able to cover yourself helps protect from other people being exposed. This face cover encouragement is a shift because of how atypical the COVID-19 symptoms are, as I discussed earlier. A very critical message to this is that cloth face coverings are not substitutes for any of the evidence-based approaches that we have been mandating as required. That is the social distancing, standing 6 feet apart wherever you are, washing your hands regularly and using hand sanitizer, and staying home when you are ill. Those are the proven approaches to work, and they must not be replaced by still going out when ill, not washing your hands, or not abiding by the social distancing requirements that we have expressed and that the governor has issued through the stay-at-home order. It's a good idea as well to wash your cloth face covering frequently, ideally after each use or at least daily. Have a bag or bin to keep cloth face coverings in until they can be laundered with detergent and hot water and dried on a hot cycle in the dryer. If you must rewear your cloth face covering before washing, it's important to wash your hands immediately after putting it back on and avoid touching your face. I want to emphasize again the critical importance of everyone following the stay-at-home order requirements. That is the determining factor, as the governor mentioned, to how we will be as a state and how our healthcare system will be able to respond in this.